Hello, my dear friends. I hope you all have gone through my previous two lectures on pharmacotherapy of Parkinsonism. And if you have understand the topic well, and if my presentation had helped you for the learning of the Parkinsonism, please subscribe to my channel, that is Pharmacology in Simplified Way. Now today we are going to discuss a very important topic in the practical pharmacology, that is prescription criticism exercise. Now in this lecture the learning objectives are: what is prescription, what are the different parts of the prescription, and checkpoints for the evaluation, or we can say that criticism of the given prescription. First of all, what is prescription? Prescription is a written order. From whom to whom? From physician to the pharmacist, and it contains name and dosage regime of the drugs, and it contains instruction to the pharmacist regarding the preparation and dispensing of the drugs, and instruction to the patient regarding its intake. But my dear friends, don't take it lightly, because prescription is a medical legal document and therefore it should be legible, unambiguous, dated and signed clearly by the prescriber. And there are two other points which I have not mentioned in this slide, that now according to the guidelines of our health ministry, that in prescription drug must be written by the generic name, that is one, and it is also advisable if write the drug name in a capital letter. Now what are the parts of the prescription? It contains superscription, inscription, subscription, transcription and signature. In the superscription, the details of the clinician like name, then degree, address and date, patient, name, age and address, and symbol RX. Inscription, it is very important, it is the heart of the prescription. It contains all the details about the prescribed drug, including the formulation, like whether it is a tablet or capsule or injection or transdermal patch or inhalation, etc., etc. Then the generic name in a capital letter, then strength. In the subscription, direction to the pharmacist, like dispense such 30 tablets, and transcription, direction to the patient, one tablet to be taken 3 times in a day, like that. And last but not the least, the signature of the clinician. Here in this you can see the different parts of the ideal prescription. In the superscription, Dr. ABC, his or her degree, address, date, for Mr. XYZ, age, address and RX. In the superscription, inscription, capsule ampicillin, ideally it should be written in a capital letter, capsule ampicillin 500 milligram. Then in the subscription, instruction given to the pharmacist, that is dispense such 20 capsule. Then in the transcription, instruction to the patient, 1 capsule to be taken every 6 hourly for 5 days. And lastly, signature of the clinician and his or her registration number. Now, if whenever you are critically evaluate any prescription, then if you follow certain checklist, then you cannot miss any important point. And in this, first and foremost is the format of the prescription, whether all parts of the prescription, superscription, inscription, subscription, transcription, signature, all these are mentioned or not. Then second, whether the diagnosis is recorded or not. Then next is the number of the drugs prescribed. Then another very important point is whether the drugs are prescribed by the generic name or brand name. As we have discussed, drug must be prescribed by the generic name. Then next is choice of the drugs for the given condition. Okay, now here I want to make one thing very clear. It is very good if the prescribed drug is the drug of choice, but it doesn't mean that if any alternative drug is prescribed, then the prescription is irrational. No, any suitable alternative can also be prescribed. Okay, so take care this point in mind while you are criticizing a prescription. And second thing is the sequence of the drugs. Sequence of the drug means certain drugs are prescribed for the main indication and certain drugs are prescribed for the symptomatic relief. For example, in a case of chloroquine sensitive chloroquine sensitive P. vivax malaria, we are prescribing chloroquine also and we are prescribing tablet paracetamol also. Paracetamol we are giving for the symptomatic relief, reduction in the temperature. So ideally the chloroquine should be written first and paracetamol should be written after chloroquine. These also you have to check. And the next is all the prescribed drugs are really indicated and necessary. These also you have to check the need of each drugs. Then very important point, that whether any drugs that are mentioned in the prescription are unnecessary, means are all the drugs are really required or not. If in the prescription, if there is any fixed drug combination, first and foremost whether the combination is really required, that is one, and second whether these FDCs are rational or not. Then contraindicated drugs. When you look at this point, the question arises in your mind that why any prescriber prescribe a contraindicated drug. But my dear friends, here you have to look this point from a different angle. I will explain you by giving a simple example. You all know that AC inhibitors, captopril, enalapril, ramipril, these are one of the first line agents for the treatment of hypertension. Okay, but now if any pregnant lady develops the hypertension and if you prescribe AC inhibitor, then it is considered as a contraindicated drugs, even though AC inhibitors are the first line agents, because AC inhibitors are contraindicated in the pregnancy. So here we have to look at a case to case basis. And lastly, any hazardous drugs, the drugs which is banned in the another country but available in this country, or we can say that the drug list under the heading of banned and bannable drugs, whether they are prescribed or not. Then very important, the dosage regime. Okay. Now somewhat sidetracked, but I want to add one point, that whenever in the exam, when the question has been asked like write the dosage regime of prazosin in benign prostatic hypertrophy, then the examiner expects you write the dosage form, then the strength, then the frequency, then the duration, everything. So dosage regime includes dosage form, dose, frequency and duration of the treatment, whether these are mentioned or not, whether there are any short forms, very important points, whether there are any short forms mentioned or not. If you have seen the different prescriptions, it is a very routine practice that instead of tablet, TAB, tab is mentioned, capsule, cap is mentioned, injection, INJ, that is mentioned. And understand this very carefully, any type of short forms must not be allowed in prescription. So one never ever has to write a short form in the prescription. And based on these criteria, you have to finally write the status of the prescription, that whether it is rational or irrational, along with your justification points. Sometimes the majority of the points are covered, but certain minor points, based on this you can write that this prescription is semi-rational, but this is theoretical. In the exam you have to write whether the prescription is rational or irrational. And then you have to rewrite the correct prescription for the given condition. Now to remember these same points from a different fashion, you have to remember certain general points and certain prescribed drug related points for that particular prescription only. So in the general points, whether the diagnosis is mentioned or not, parts of the prescription, all parts of the prescriptions are mentioned or not, number of the drugs prescribed, short forms, as I told, no short forms is allowed, dosage schedule, instruction to both patient as well as the pharmacist, and lastly the drug is prescribed by the generic name or not. Now these points, that evaluation of these points will be applicable to each and every prescription. Then there are certain prescription specific points. So prescribing drug related points, these are whether the prescribed drugs are indicated, then the sequence of the drugs, whether they are appropriate. First you have to write the main drug which is used for the treatment, then the drug which is for the symptomatic relief, and then you have to write the non-pharmacological measures. Then are there any drug interaction between the prescribed drugs? Then any contraindicated, irrational, banned or bannable drugs are prescribed or not. Then dosage route, strength, frequency and duration. So complete dosage regime of the prescribed drugs. So these are all the prescribed drug related points. And after writing all these general and prescription specific points, then you have to justify your answer that whether the prescription is rational or irrational, and then you have to rewrite the correct prescription. I am giving you one exercise. I am narrating out the exercise. Criticize, correct and rewrite the following prescription meant for 35 years old male, complaints of stuffiness of nose, feverishness, headache with the diagnosis of common cold, and this is the prescription. You have to criticize it, you have to correct it, and you have to rewrite it. You can give your suggestions in the comment box, and if you find this presentation helpful, please subscribe to my channel Pharmacology in Simplified Way. You can also write in the comment which other lectures do you want from my side. That's all from my side. Thank you very much.